my name is Connor Howells and today I'll be completing Practical Assessment 34, the hemorrhage control and first aid of a patient. Today we have Jim Bob here, who was presented to the clinic with an arterial hemorrhage and deep laceration down the front left leg from the carpus all the way down. So we want to make sure that we have all of our initial assessment equipment available readily on hand, plus we want to make sure that we have all of our preparation equipment all set up for Jim Bob's arrival to the clinic. So I want to make sure that I have a stethoscope and my nursing belt ready to go when he arrives to the clinic, so I can check his breathing, I can ascertain anything else, I can check his eye tone, plus his CRT, plus his mucous membrane, make sure he's breathing and everything's okay prior to bringing him to the back for treatment. Then we want to make sure that we have all of our stuff prepared. So we have plenty of clean gauze here, clean non-woven linen gauze, plus we have a kidney dish full of saline. Then we all have all of our bandage material as well. So that's our pressure bandage material. If the wound stops bleeding and the vet would like to wrap the wound, we have a comforting bandage, plus we have Elastoplast and the vet wrap as well on hand. We have all of our catheterization equipment, so a blue catheter here as he is a big dog, plus our alcohol swab, tape and shaver here. Then we have our fluid bag as well that we've got here. We've got our fusion set, extension lead, and saline fluids here. You can also use Hartmann solutions as well. You want to make sure that that giving set is primed and ready to go prior to Jim Bob's arrival. We want to make sure that the O2 equipment is all set up, so the anesthetic tubes have been connected to the machine, they have been leak tested and they have all been checked. We want to make sure that we have various sized ET tubes available that have also been checked, make sure that there's no holes and that they are inflating all okay. And then we have all of our PPE equipment as well. As it is an arterial hemorrhage, we make sure that we always have gloves on. I like to have a mask as well, plus you can also wear a disposable gown if you would like to keep your scrubs clean, or disposable booties. To initially control the hemorrhage using a pressure bandage, we want to make sure that we have clean gauzes ready to go. We want to make sure that they are fully soaked in the saline prior to applying, making sure that they are fully soaked, and then applying gentle yet firm pressure on the wound. So we want to make sure that the entire wound is covered, that no blood is seeping out of the gauze, and it is gently placed over the top with gentle pressure. It is ideal to have a second person to help restrain. You always want to make sure that you are coming in on the side, that you're observing the canine's body language, you're checking the tail position, the ears, the eyes, the tongue, the pupils, any whale eye as well, any gritting of the teeth. You want to make sure that you're observing all of his body language, because that can exacerbate very quickly and it can get quite unsafe within the clinic, if especially that we are touching such a tender and painful area of Jim Bob. He may thrash, he may throw himself around and get quite exacerbated, and we don't want to do that to the wound. So I like to have that second person come around, get their right arm gently under the neck, but not putting too much pressure on, making sure that they are firm against the body, so Jim Bob doesn't have anywhere to go, but you are nicely positioned on the rear end. Dealing with strike through when it comes through the bandage, we want to make sure that we get another clean soaked gauze as well, making sure it is fully soaked again. You then want to apply it on top of the already soaked saline bandage that has got the strike through coming through. This is to, if you remove that bandage from underneath, you may dislodge any clots that are beginning to form, and this may exacerbate the wound further. To communicate to the veterinarian, I would advise that the owner is coming down to the clinic within the next 30 minutes, that I have told her to apply pressure to the wound using a clean, damp linen or cotton to keep him comfortable and as calm as possible, that his mucous membrane color, that he's breathing, that he's conscious, is he able to walk, how much blood has been lost, and the time frame of how much blood has been lost, just to give the vet an overall idea of the patient that is coming in. I then recorded all of these details on the patient file on our practice management software, which is IDEXX Neo, and I advised the veterinarian and the nursing and reception team within the area to let them know that an emergency situation, an emergency case is on the way and will be needing treatment as soon as possible or as soon as it enters the clinic. If I was to take this triage phone call from the owner, I would ascertain as many questions as possible from them. So I would ask, what's your main concerns? Is the pet breathing? Are they conscious? Can they walk? Is there any open fractures? Can you see any bones? Can you see an open wound? How much blood has been lost? The frequency of it? I would then advise the client to come down to the clinic as soon as possible. There might be quite a lot of blood loss already, and he might be going into hypovolemic shock. So I've categorized this as a triage category 2 as an urgent emergency, which can exacerbate further. I would then advise the client to remain as calm as possible. As it is a heightened situation and is an emergency, the owner might be quite frantic and may be very stressed. For the workplace health and safety, we want to make sure that the owner and the patient is safe during transport and travel. So I advise to create a comfortable bed in the back seat with plenty of towels and blankets to keep him calm and quiet during the transport ride over. To drive as carefully as possible but hastily, as it is an emergency. To have a second person on hand, a family member, a friend, a neighbor, someone that can help assist the owner with getting Jim Bob in the car, also applying a pressure bandage on the wound. This will help with any further contamination of the wound, prevent any additional trauma during transport that may occur through thrashing or throwing themselves around, and it can help with hemostasis as well. But other than that, that is everything today. That is Practical Assessment 34, the hemorrhage control and first aid of a patient.